Welcome back. There have been some reports lately with a connection between some hormone therapies and cancer. And here to give you a closer look at some of the issues that have been reported and to talk about some of the options you have when it comes to natural hormones. Today, we're pleased to welcome Dr. M. Nicholas Martin and Dr. Rod Malsom from HRC Medical. Thank you both for being with me today, gentlemen.
Thank you for this opportunity.
Now, we were talking a little bit earlier. These are some studies and some published reports that have come out and have talked about some of the connections between cancer and different kinds of hormone therapy. And you just want to take a moment to kind of clear up what those studies are talking about and sort of the differences in the hormone therapy.
Sure. All natural hormones come from plants. And back in the early 40s, there was an attempt by pharmaceuticals to patent that process, which the FDA did not allow. And so the drug companies were smart enough to go at it from another angle. They started producing synthetics, which could be a patentable process. However, down through the years, it's kind of all been thrown together and considered hormones are hormones, but they're not. Some are natural, some are synthetic. And so a few months ago, there was a big splash on network TV about the fact that hormones do cause cancer. Well, that is incorrect. All natural hormones do not cause cancer. It's the synthetic variety that they put them in a panic because all these women getting Premarin and those kinds of products, Premarin being the biggest seller they have in the world. And so they're trying to preserve their, they're worried about that. But we get thrown in with that. And we'd appreciate the opportunity here to just come and dispel that notion.
I'm sure a lot of people have questions, and for a number of things that hormone therapy can be used to benefit patients. What are some of the things that you want to make sure they know about the natural hormones and what they can offer?
Well, basically hormones are induced enzymes, DNA to make enzymes. And so it's really important in all kinds of metabolism. But in this situation, we like to emphasize the fact that when you have going into menopause or when you have andropause, which means a man losing his testosterone, that they're looking for options to regain some of those functions. And sometimes it's simple diseases like diabetes. I mean, that's made better with testosterone. And a lot of people will come in and they'll be out of control in diabetes. You can put them on testosterone and it really brings down the control much better. It's a lot of approaches that we can use. For instance, in osteoporosis, testosterone, natural bioidentical testosterone, in many studies have shown to be totally safe. Does not cause increased cancer, and it will increase bone density by 8%. In 1 year sometimes, which is almost 4 times as good as any Boniva or anything else out there like that. So when we go to the natural, when we go back to natural hormones, natural reasons for using it is basically to anti-age. See, I'm board certified in anti-aging medicine, and when you look at aging, it's a combination of losing products that keep you healthy. And that means hormones sometimes it means cofactors that you just don't get in your diet or you don't make. A lot of cofactors that help enzymes work and make products that make us healthy, they just aren't made in the body due to some lack of hormone that doesn't induce the enzyme that makes that product or something. So it's complicated. So when somebody comes in that gives us the story that, I'm feeling bad, I'm nervous, I've lost my libido, function's not there anymore, whatever, when you bring these people in and you treat them, most of these people will respond, and they will feel much improved in terms of their fact that they have managed to gain some function back that they may have lost that was really bothering them.
An important point to mention that you said as well, that one thing that is in common, just like the synthetic hormones that are through doctors, you are a physician and you oversee the treatment plans and that sort of thing. So definitely still a medical process.
Yes, and it's different in the sense, a lot of companies now are getting into bioidentical things. Don't get me wrong, there's some patches out there, there's some other things and hormones that they've gone to because they realize that the old methyl testosterone and the old Premarin did enhance proliferation. But anytime you have a cause for proliferation, you need to remember the body will have, in a lot of cases, a protection against that. And the protection for women goes back to iodine. If you look at the Japanese women who eat a lot of seaweed, they have practically no breast cancer. They come over here and live with Americans, and they get the same rate we do. And if you look at simple lose progesterone early in life. That's a protector. If you can be taking that, that protects you against proliferation. But bioidentical hormones do not enhance those kinds of things. They're going to happen if you don't have those protections. And when you go into a physician, you've got a little hypertension, he says, get off salt. What else are you getting off of? You're getting off of iodine. So when you're, if you get off of iodine, then you lose your iodo-lactone, which is a chemical that's made with iodine that causes a cell to stop proliferating. See?
Well, fascinating information, and thank you both for being here with us to share that and to kind of clear up some of the things that you may have been wondering about. And if you would like to learn more about HRC Medical and their services, you can give them a call. The number's there at the bottom of your screen, and their website as well if you'd like more details. Thank you both again for being with us.
Thank you.
Thank you. Appreciate it.